Well, welcome to PhDizzle. I'm your host, Alice Cheng, and today I'm interviewing Dr. Najmeh Hoseini, who got her PhD in Kinesiology with a minor in Neuroscience from Indiana University and is currently a professor of physical therapy. I would love to learn a little bit more about your background. It sounds like you've done a lot of different things and your career transition to where you are today is really interesting. So why don't we start at the beginning and talk a little bit about your PhD in kinesiology?
Oh, absolutely. So I'm a trained physical therapist and I'm from Iran. So I got my physical therapy degree in Iran. But then I came here for a PhD in kinesiology with a minor in neuroscience. Kinesiology is a big umbrella of several different things like exercise physiology, like biomechanics, and also motor control, which that was my focus. And motor control a lot of the times falls under actually neuroscience. So I'm kind of in the middle of kinesiology and neuroscience kind of field. And my PhD a lot of it was in neuroplasticity and how brain changes based on what we learn. The topic that I worked in my PhD, a part of it was about spinal cord and how spinal cord is actually smart and spinal cord kind of learns a little bit. I did a research on someone that had a stroke in a younger age, and then we gave him a practice of a training, and then he could control his reflexes. And then I moved up to brain and I studied the brain excitability after some training. And I used transcranial magnetic stimulation to map the brain. To map the brain. It kind of shows how excited the brain is. So you stimulate the brain and then you record it from muscles. You stimulate a very specific part of the brain that moves the specific muscles, because our brain has a map of our body, and that's how our brain moves us. So if you stimulate in a specific place in your brain, then a specific muscle starts to move. And that's exactly what I did. And I studied how the brain excitability changes based on the intervention that I introduced to my subjects. And the intervention was kind of electrical stimulation in their hand. And that actually excited their brain enough that they moved things in my testing, which I had a test for manual dexterity. They would move things and I would time them. They got better based on that electrical stimulation.
Oh, wow.
So one of the things that I used in my intervention was something called transcranial direct current stimulation, which is putting DC current on top of the brain.
Oh my God.
You actually put it on the head, and it's a wet electrode that can send the signal to the brain. So it's totally safe and non-invasive. And then it kind of excites the neurons in the head. So they get more excited and accept the change. The thing is, whatever we do changes our brain. Mm-hmm. Every day our brain changes, and neuroplasticity is the base of how we learn, how we communicate, how we move, and how we forget.
So then you mentioned your professor career. So as you move from academia to other parts of academia, tell me what that was like.
I chose the path of using both my degrees, physical therapy and PhD, to become a faculty in physical therapy departments. Physical therapy, the curriculum is so intense that there's not a lot of space for research left, because you teach a lot, because the content is so much that students have 3 years to get a doctoral degree, and that's a lot of content for teaching. But I want to emphasize, a lot of students that finish a PhD, they really need to do a postdoc. My situation is kind of an exception. A lot of people have exceptional situations because they have a different degree on top of it. So right. I have 2 different degrees. I have physical therapy and PhD on top. So that's why for me, it was easy to get a job right away.
So, you're teaching, you're seeing patients, you were doing research, you're kind of still in the back of your mind thinking of things all the time, but what are you doing in your downtime, if you have any?
I paint, I do yoga, and I hang out with my friend, I go on hikes. But painting is definitely something that I've been with me since I was a kid. Mm-hmm. I love it. It's kind of like a meditation. I do meditation too. Yoga is my favorite kind of workout.
Tell me a little bit about your paintings.
Okay, so this is a watercolor of a subject that was sitting in front of me in an afternoon. It was like one of my first portraits. Like this was my second watercolor portrait. So as much as it's really easy for me to draw faces, painting, especially with watercolor, was very painful, but I love this painting. This is something that I worked on for many, many days. This is my favorite Persian Iranian / French actress. She was an actress in Iran when I was in Iran, and then she kind of almost ran away because there was a lot of political issues with her because she played in movies that were not Iranian, and she showed her hair, and so she kind of got forced to leave the country and live in France. And she's an amazing actress. This is one of the recent style of painting that I tried. I went to Istanbul last August with my family to just visit my family in Istanbul in Turkey, and I got there one day early, and then I went to this gallery of paintings similar to this. So it's painted mostly with the knife, like there's barely any brush work.
Wow.
So these are all knife. Oh, wow. So it's all with knife. And I saw this type of painting, and it really inspired me, and I painted this on Christmas Day of 2019.
Oh wow.
This is something that I'm very proud of. I learned how to use different colors like green and blue and purple in a face. So this has a story. I signed up for this class, one of the best watercolor portrait painters, and he already emailed us that you need to have a subject. I was traveling to go to a conference for presenting my work. Actually, I was on the way back. I saw this girl. She was African American, and she was beautiful. She had that head scarf on top of her head, and I just looked at her. I'm like, I want to paint her. And then I felt kind of creepy to go and tell her that, hey, I want to take a picture of you. But I did. After the plane landed, she came out of the plane. I just went to her and I said, this is my credentials. I'm a professor, and I took a painting class, and I need to have a portrait subject. And I just saw you in the airport, and I really think that you would be a great subject. Can I take a picture of you? And she was actually very flattered. And she said, sure, of course. Can you just send me a picture of that when you're done? And I said, of course. So we exchanged numbers, and I did send her a picture of that. This is a painting that is in the back. It's very big. It's 3 feet by 3 feet. And I painted it for years, and I'm still not done with it. But a lot of people think that it's done. It's actually not done because, like, see, it's not done. Like, this hand needs to be worked on. But I painted this without taking any classes and not knowing anything about anything. I started this probably 5 years ago, and I kept working on it. But then at some point, I'm just like, you know what? I'm just going to put it up. And it's very authentic. For me, it's very authentic because I just did it by myself. I didn't learn how to do it. And I think my knowledge of anatomy and human body really helped me when I was painting it. Like creating those bones, like when I was painting the arm, the forearm, I really felt like, oh, this is like this bone. And this is so it was kind of funny how my knowledge of anatomy came to work with my paintings. I was about to finish it in a time that I lost my dad, so I didn't finish it. Then a year or two later, I started again, but it's so heavy. I do have a dream. I want to do more for patients. I want to be more independent. I want to have a different platform for education. And I want to eventually get my paintings out there, not just because of extra money, which is always good, but also because I want that to be a part of my career. I don't want that to be something hidden. Sometimes we are so scientific that we forget about a part of our wellness that is a spiritual wellness.
Yes.
I taught a class called Wellness and Wellbeing for physical therapy students when I was in Arizona. And a part of it was this questionnaire that you would take. And a part of questionnaire was mental health, physical health, emotional health, social health, and then spiritual health. And unfortunately, in a lot of science-based education, the spiritual part is the superstitious part. So that's how a scientific mind think of it, but it's more about having meaning in your life and having hope in your life. And that's something that meditation helps a lot with. To be able to treat patients, you need to be able to be healthy yourself and give your patients a role model kind of thing about yourself, that I am healthy. And that affects your communication with people, that affects your treatment, that affects the energy that you're bringing to the table. A lot of the times I think that I should have this communication with PhD students, not being one-dimensional. Unfortunately, PhD gives you that mindset of being one-dimensional and knowing it all and thinking that life is just one thing, and that's very dangerous. Sometimes I feel like I forgot about what I have to offer. Sometimes it's good to bring this out of people, and show it to other people and say, hey, look, you did a PhD and it was difficult and you almost went to the edge of depression, and you can get out of it. I mean, I had severe depression the first year of my PhD.
Oh, wow.
Because you move to a different country, you don't know the language, you're dealing with a PhD program, you don't have any friends, you don't even know how to talk in the class. It was awful.
Yeah.
And getting out of that is like everything, you know?
Yeah. I think, you know, as you move on in life, and I've experienced it too through moving, you know, when you go different places and you're in different life stages, I think the PhD is probably the first time you experience it. And then if you learn how to deal with it, you have armor for, you know.
Oh, absolutely.
You know, but PhDizzle.
Having fun with smart people who do cool things.
High five.